Now, primary angle closure glaucoma. As in the previous lectures, we discussed primary open angle glaucoma. Okay. So, what is primary angle closure glaucoma? It is like the primary open angle glaucoma. It is the bilateral optic neuropathy, which is characterized by the increased intraocular pressure due to the close angle. Okay. So, the IUP will be elevated due to the angle closure. The interior chamber angle closure will cause the increased intraocular pressure, and this increased intraocular pressure will cause bilateral optic neuropathy. This is called primary angle closure glaucoma. Okay. So what are the etiology and epidemiologies? Remember, there are genetic factors and general factors which predispose a patient to primary angle closure glaucoma. Okay. We have the genetic factors. These are the developmental anomalies. For example, a person may develop primary angle closure glaucoma if the eyeball is smaller. The eyeball is smaller than normal. Okay. When the eyeball length is smaller than normal, it is predisposed to angle closure glaucoma. It may be the interior chamber depth. If this is the interior chamber depth. Okay. So in these patients, the interior chamber depth will be no more than 2.4 millimeter. Okay. This is because of the iris and the lens. The iris and the lens interior dislocation. Okay. So this is called the iris and lens diaphragm interiorly dislocated. So because of this interior dislocation, it will reduce the interior chamber depth, which will be no more than 2.4 millimeter. And another thing is that the corneal diameter. The horizontal corneal diameter will be smaller by 0.25 millimeter than normal individuals. Okay. So the interior corneal diameter will be smaller by 0.25 millimeter. And we will have the narrow angle. Okay. We will have the narrow interior chamber angle will be narrowed. And these patients may have hyperopia. So hyperopic patient, far-sighted people, they are mostly exposed to the primary angle closure glaucoma. These are the genetic factors and anomalies which predispose a person to angle closure glaucoma, but we also have some general factors. These general factors are that the female are mostly exposed. Okay, there is the ratio 4:1 to female to male ratio is 4:1. So it is more common in female and more common in Chinese people and the people of Southeast Asian. Okay. And remember, the nervous individual, type A personality with unstable autonomic nervous system. Okay. So these people, they are predisposed to angle closure glaucoma. The female, Chinese, Southeast Asian and type A personality. Okay. These are predisposed. Now we have the stages. Okay. So we have mainly 5 stages of angle closure glaucoma. These are primary latent or angle closure suspect stage, primary subacute or intermediate angle closure glaucoma, okay, and primary acute angle closure glaucoma or primary acute congestive glaucoma. And this third stage can enter into the fourth stage, which is the chronic angle closure glaucoma, and ultimately this fourth stage can enter into the last stage in which we have a hard blind eye. This is called absolute glaucoma. Okay, so these stages can follow each other. Okay, but remember, these can follow each other, but these stages can directly go. For example, the primary latent stage can directly go into the primary acute stage, and the primary subacute stage can directly go into the chronic angle closure glaucoma. So these are the stages, mean that the stage 1 is less complicated, stage 2 will be more complicated. So these stages are showing that now the angle closure glaucoma has complicated. Okay. So the first stage is the primary or angle closure suspect. So we will discuss each of the stage with details, with the pathogenesis, clinical features, diagnosis and treatment. Okay. So the first stage in the primary angle closure glaucoma, it is the primary or latent angle closure suspect. So what is this? When a patient presents to us in this stage, he or she will be absolutely normal. There will be no intraocular pressure, will be absolutely normal. Okay? But when we take a look through the eye, what will be found that these anatomical anomalies will be present. For example, the interior chamber depth, it will be smaller than normal. Okay, the angle, the interior chamber angle, okay, it will also be, if it is not closed, it will be narrow, okay. So we will have reduced interior chamber depth, we will have narrow angle, okay, and we will have positive provocative tests. Provocative tests, these are the tests in which we cause the mid dilation of the pupil, okay. Mid dilation of the pupil will cause relative pupillary block and will increase the intraocular pressure. So in these tests, we will measure the pressure before the test and after test. And if the difference is more than 8 millimeter of mercury, we are inducing a block, a pupillary block, which will increase the pressure, okay. So before the test and after test, if the difference in these results is more than 8 millimeter of mercury, this is called provocative test is positive, okay. So these will be the clinical features in which the primary lateral or angle closure suspect case will present to us. So what is the problem if the patient is normal? So what is then the point? Remember, I am telling you, but first of all, we diagnose these anomalies is diagnosis with the help of gonioscopy, okay? The analysis and evaluation of the interior chamber angle with gonio lens is called gonioscopy. So we will diagnose the case with gonioscopy. Now we will come to the treatment, that why it needs treatment. As the patient is normal, so what is the point of treatment? Remember, I told you that this primary lateral or angle closure suspect stage can enter into these progressive stages and the case will be complicated as these are the predisposing anomalies which can develop into a full-grown glaucoma. Okay, so we have to do prophylactic treatment. This prophylactic treatment includes laser peripheral iridotomy and surgical peripheral iridectomy. Laser peripheral iridotomy means with the help of laser, we will make a small pore in the peripheral iris. So the fluids in the posterior chamber, the aqueous in the posterior chamber will bypass this pupil and will directly come into the anterior chamber and will drain. So it will maintain a normal intraocular pressure. And with the help of surgery, we can remove some part of this peripheral ulcer iris. This is called surgical peripheral iridectomy. Okay, so laser peripheral iridotomy or surgical peripheral iridectomy we are doing as a prophylactic treatment in order to maintain the normal intraocular pressure for the rest of the patient life. Okay, so we have to do prophylactic treatment in order to prevent the complications. So this was about the etiology, epidemiology and the stage 1 of the primary angle closure glaucoma. Okay, we will discuss the other stages as these are important and they need explanation, so we will discuss in the upcoming lecture. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.